Administrative costs. The U.S. healthcare system involves a complex web of private insurance companies, each with their own billing processes, plans, and policies. The overhead for administration in private insurance is higher than that of single-payer systems or government-run healthcare programs. Hospitals and providers also bear the costs of dealing with multiple insurers. Drug prices. The U.S. often has significantly higher drug prices than other developed countries. There are various reasons for this, including the power of pharmaceutical companies in setting prices, prolonged patent protections, and the lack of a centralized government negotiating body. Defensive medicine. To avoid malpractice lawsuits, providers in the U.S. might order extra tests, procedures, or visits, even when they may not be strictly necessary. Medical equipment and service prices. The prices for medical services and procedures are often higher in the U.S. than in other countries. A lack of transparency and competition, along with the fee-for-service model, can drive these prices up. Chronic diseases and lifestyle. The prevalence of chronic conditions like obesity, diabetes, and heart disease can lead to increased healthcare costs. Lifestyle choices, including diets and sedentary lifestyles, contribute to these diseases. Lack of preventive care. Delaying or lacking preventative care can result in more serious health issues down the line, which are more expensive to treat. Fragmented system. The U.S. system is a patchwork of private insurance, public programs like Medicare and Medicaid, and uninsured individuals. This fragmentation can result in inefficiencies and lack of coordination, driving up costs. Regulations and compliance. The regulatory environment in the U.S. can add to the cost. Compliance with rules, both at federal and state levels, requires significant administrative efforts. Uninsured population. When uninsured individuals can't afford to pay for care, those costs are often shifted to others in the system. As a result, insured patients might bear the cost through higher prices. Profit motive. Many parts of the U.S. healthcare system operate on a for-profit basis, including hospitals, providers, and insurance companies. This can prioritize revenue generation over cost containment. Innovation and high-end services. The U.S. is a leader in medical innovation, research, and high-end services, which can be costly. Aging population. An older population means a higher demand for healthcare services, which can drive up costs. Specialization over primary care. There's a heavier emphasis on specialized care rather than primary care in the U.S., and specialized treatments tend to be more expensive. Despite its high costs, the U.S. does not consistently achieve better health outcomes than other developed nations, which has prompted ongoing debates about healthcare reform. Efforts have been made to address these costs, but achieving meaningful change in such a complex system is challenging. Administrative complexity. The multi-payer system in the U.S. introduces layers of administrative tasks that don't contribute directly to patient care. This includes billing, insurance underwriting, navigating multiple sets of regulations, and so on. Some estimates suggest that nearly a quarter of U.S. healthcare expenses come from administrative costs alone. Pricing and lack of transparency. The U.S. doesn't have standard pricing for healthcare services. The same service or procedure can vary in cost not only between states but even between hospitals within the same city. Without transparent, predictable pricing, consumers lack the necessary information to make cost-effective healthcare decisions. Negotiation power. In many countries, the government has a significant role in setting or negotiating the prices of drugs and medical services. In contrast, the U.S. typically relies on individual insurance companies or hospitals to negotiate prices, which may not have the same bargaining leverage. Fee-for-service model. The prevailing model of healthcare compensation in the U.S. is fee-for-service, where providers are paid for each test or procedure they perform. This can incentivize overuse of procedures and tests, rather than focusing on outcomes or overall health. Lack of centralized, universal coverage. Unlike many other developed nations, the U.S. does not have a centralized, universal healthcare system. The lack of such a system can lead to inefficiencies, missed preventive opportunities, and more emergency room visits, which are significantly more expensive than regular doctor visits. Hospital consolidation. Over time, many hospitals have merged, reducing competition. Less competition often leads to higher prices for services. Education and training costs. medical education in the U.S. is costly, leading many new doctors to begin their careers with significant debt. This might influence them to choose higher-paying specialties or to pass on costs to patients. Medical malpractice and litigation. The U.S. has a relatively high rate of medical malpractice suits. While not the primary driver of costs, malpractice insurance and the practice of defensive medicine, ordering extra tests and procedures to safeguard against potential lawsuits, can contribute to the overall expense. Healthcare lobbying and politics. The pharmaceutical and health product industry has significant lobbying power. This can influence regulations and policies that might otherwise work to reduce costs. Cultural attitudes. There's a perception in the U.S. that more care, tests, treatments, interventions, is better. This belief can lead both doctors and patients to pursue aggressive treatments, even when they might not improve outcomes. To address the soaring healthcare costs, various solutions have been proposed and tried, from the Affordable Care Act, ACA, aimed at increasing insurance coverage and adjusting care provisions, to discussions about a single-payer system or Medicare for all. Yet, finding a universally agreeable solution has been elusive due to the complexity of the system and differing opinions on the role of government, the private sector, and individuals in healthcare. Brand versus generic medications. The U.S. often sees a higher utilization of brand-name drugs over generics, which can be more expensive. End-of-life care. The U.S. spends a significant portion of healthcare dollars on aggressive treatments in the last months of patients' lives, often with little potential for extending life significantly or improving its quality. Direct-to-consumer advertising. The U.S. is one of the few countries where pharmaceutical companies can advertise directly to consumers, potentially driving demand for more expensive treatments. Healthcare worker salaries. Salaries for certain healthcare professions, such as specialists and surgeons, are often higher in the U.S. compared to other countries. Low primary care utilization. Compared to other developed nations, the U.S. has a lower ratio of primary care visits to specialist visits, leading to more expensive specialist-driven care. Access to care. In certain areas, especially rural ones, there's a lack of healthcare providers. This lack of competition can drive up prices. Epidemic of loneliness. Emerging research suggests that societal factors, like loneliness, can have significant health implications, leading to increased hospital readmissions and more frequent healthcare usage. Infrastructure and facility costs. U.S. healthcare facilities, especially private ones, might invest heavily in state-of-the-art infrastructure, luxurious patient rooms, or advanced technology, sometimes more than what's clinically necessary, which can contribute to higher costs. Limited use of technology in administration. While the U.S. has advanced medical technology, there's sometimes a lag in adopting technology for administrative streamlining, leading to inefficiencies. Lack of continuity of care. Patients might see multiple providers without coordinated communication among them, leading to redundancy in tests and treatments. Mental health care. The U.S. faces challenges in adequately addressing mental health, leading to emergency interventions that are costlier than regular therapy or early interventions. High rates of unintended pregnancies. Unintended pregnancies can lead to increased medical costs, both in prenatal care and postnatal care. Overtreatment. Driven by both patient expectations and provider incentives, there's a tendency in the U.S. healthcare system to offer treatments even when they might not be medically necessary. Health disparities. Economic and racial disparities can lead to unequal access to preventive care, leading to more expensive treatments down the line. Tax treatment of health insurance. Employer-provided health insurance is tax-free, making it a preferred form of compensation, which might inadvertently promote more expensive insurance plans. In the face of these multifaceted challenges, many stakeholders, including policymakers, medical professionals, insurance companies, and patient advocacy groups, are seeking solutions. However, the complexity of these intertwined factors makes straightforward solutions elusive.